this event will be recorded. We need to say that. Good afternoon, people. Welcome to this fourth webinar on JSI Puede. Thank you, Ana. Thank you, Angel. Thank you, Andrea, for putting all these together, sometimes at the last minute. Today we have a person that I have a lot of admiration for. He lived with us in Boston, in the city of Boston for 27 years. And he was one of the pioneers and champions of the Latino LGBT community. As a matter of fact, he was one of the organizers of the first Latino Pride event. I think among the largest. I think that in the United States, that serves me right. So he was here working with us in many organizations. We always kept in touch with the Latino community that works on HIV. It's very, very small. So I always, we were always in touch. Wilfred then returned, Dr. Labiosa then returned to Puerto Rico to take care of his parents. And while there, Dr. Labiosa, being Wilfred, he decided to put together a nonprofit organizations named Waves Ahead. Waves Ahead is, appropriately enough, is a term that surfers use when waves are ahead, of course, so coming ahead. That's what I think. So, and he is focusing on Latino elderly. And as you can see, there are many intersectionalities in what Wilfred is doing in terms of social determinants of health, HIV, substance use, poverty, housing, economy. I need not to tell you about how the situation is in Puerto Rico, because last year, Ms. Alexandra Bonet presented to you all and presented a picture of the situation in Puerto Rico and how the LGBT community and folks living with HIV have survived about this incredible natural disaster, to hurricanes, earthquakes, Zika, and now COVID. One of the things that we are doing, Wilfred also brought in SAGE to Puerto Rico. SAGE is the largest LGBT elderly advocate organization. He brought a chapter to Puerto Rico. Lately, Wilfred and Alexandra and I, we were, and say hi, Alexandra, just go like this so that people can remember you. We developed a needs assessment, the first needs assessment with elderly living in HIV. Very complicated. Imagine people over 50 living with HIV, AIDS, and members of the LGBT community. It's a very difficult, it's a very hard, hard group to have access to. Today I asked Wilfred yes, he's going to mention the study, but later on, when we finish the entire thing, we can have a more complete presentation of the study. But I want Wilfred to talk about the situation of the LGBT community in Puerto Rico. For example, a couple of years ago, I took the people from the National Minority AIDS Council in Puerto Rico, and while visiting a hospice, Paul Kawata, he said, skinny. I haven't seen skinny in a long time, because the folks there, some of the patients were emaciated, very, very skinny, like in the 1990s. That really broke my heart. Right now, Wilfred is said with, and people of folks in Puerto Rico dealing with conversion therapy. yes, there are people want to, they are fighting against us. So that's the situation is. So Wilfred, without much ado, please, thank you for joining us, and please go ahead and talk to us.
Thank you, Dr. Vega, for that presentation, and thank you for making this time. It's great to see Alexandra online, so hola. Although we are in the same country, it is hard for us to connect. The COVID situation is still very much alive here in Puerto Rico. Today, the governor will announce new measures to stop the spread of COVID, so we're not sure what will happen, and we will see. But so as Dr. Vega mentioned, I'm Wilfred Labiosa, and I did live in Massachusetts for 27 years. I do know many of the folks of JSI. We work together in many projects with the Fenway Community Health, as well as with the Latino Health Institute, Casa Esperanza, and other projects that I led during that time. I miss Boston, but not the cold weather. So I see some folks with green plants, so I'm assuming you're not in Boston. So that's great to see greenery. I don't miss the cold, but I do miss the people, the warmth of the people that I still connected with, and among them, Rudy is one of them, and I really miss that camaraderie that existed in Puerto Rico, in Massachusetts, that unfortunately in Puerto Rico does not exist. So let me begin there, is that when I moved to Puerto Rico, now it's going to be about 7 years ago, I saw that there was a lack of services for the larger, older population. And as you may know, Puerto Rico is becoming older by the year. And by 2025, it's supposed to hit almost half. And by 2030, it's going to be over 70% of our population will be elders. And so there is a lack of resources to them. And then when you talk about LGBT elders, then there's even a bigger gap, a bigger hole in services. And then when you mention people living with HIV, elders 50 plus, then there is a bigger connotation because we assume that Ryan White funds are being utilized in the most appropriate manner, but maybe is not correct. And so that's why we at Waves Ahead made the commitment that every year we will be conducting some studies on different topics. Last year was about housing. This year about the population of HIV/AIDS living 50 plus, LGBT. Next year, we're not sure yet where we're going to take, because legislators here have started to outreach to us to focus it on mental health, which is a major gap and that you'll see shortly. But we will see where we take, and hopefully JSI is there alongside of us doing and leading this research here in Puerto Rico. But before I start presenting you a little bit more about Waves Ahead, I wanted to introduce a video that, although it's a little bit old, it's not that old. It's just about a year old, and that it tells you a little bit about our overview and about what we base our work on. So Angel, please.
Love seems simple, but history has proven differently. Love is our anthem, but love is more. Love is power. Love is everything. There is nothing but love. Love is more than a catchy tagline. Love, it's why Waves Ahead came to be in the summer of 2017, created by Wilfred and Griselle. Waves Ahead, a nonprofit organization that works with marginalized and vulnerable sectors in Puerto Rico, including LGBT seniors, female heads of household, the homeless, and others, helping them by supporting their development and strengthening their life skills. In such a short period of time, Waves Ahead has achieved so much by managing organizations, developing programs, providing key services, and enabling initiatives in Puerto Rico, including SAGE, Puerto Rico Chapter. specialized community center. PFLAG, coming soon. PIPES, for enriched living. Reconstruction efforts with Reconstruye and more. What a beginning! But there's still a lot to be done, always fueled by love. Love. What's next? What kind? How big? How eternal? Why does Waves Ahead do it? To serve and define love. To share that love, because we are all love, and love has rights. Love has needs. Love needs support. Love needs visibility. Love needs health. Love needs to be heard. Love needs love. Because when love wins, we all do. Happy anniversary. We will continue with your support and with love.
Gracias. Gracias, Angel. So that tells you a little bit about us. And as you heard, we started in the summer of 2017. And although our goal was to begin right away providing mental health services, the atmosphere brought us something called hurricanes in the form of Maria and Irma in 2017. So after a few months of establishing ourselves, we found ourselves working with a project. We called it Reconstruye Q. Reconstruye Q, we provided short-term mental health services as well as goods in the form of food or toiletries or generators to more than 18 different municipalities, including the municipality of Vieques. And then during that time of Reconstruye Q, which we started 2 days after the hurricane hit our island, we approached members of the diaspora who are Puerto Rican and or LGBT to support our initiative because we were finding that homes were totally destroyed. And even at the beginning, the government was not supporting them by providing them food, by providing them that connection. And so we developed the rebuilding efforts, although we're not builders at all. We started that initiative with volunteers, and we were happy to report that we were able to develop, as of last year, we finished that program with 21 homes rebuilding. We only spent a budget of $325,000. Thanks to the 85 individuals that provided more than 3,892 hours of volunteers. And I mentioned that not to be that you feel impressed about us, but more that you take into account that the government has spent more than that in just very few homes. One home in a project that the government had spent over $80,000 for just constructing a toilet, literally a toilet and a bathroom. So we, with the initiative, and thanks to many of the diaspora folks, we were able to do 21 homes impacting 21 families with 53 individuals ranging in age between 7 and 93. From those 21 homes, 17 homes were from LGBT people, meaning that we also rebuild those neighbors that needed that aid and that were not approved by the government. We, at the earthquakes, during the earthquakes, we also provided help to 2,438 individuals in 6 municipalities impacted by the earthquakes, and we provided mental health sessions. I was trained in SBIRT, Screening Brief Intervention Treatment Program, based on substance abuse recovery, but I have been able to implement it into more about your physical needs. So I have used SBIRT here in Puerto Rico to know more about their physical needs and also about their mental health needs. And we provided those for 3 months in more than 2,000 individuals. I have approached the Red Cross, and recently, the last 3 months until July, we were able to impact 289 individuals, providing them vouchers for $250 each so they could buy their medications, so they could get mental health supports in an ongoing basis, and train them on how to react to an earthquake. The island still shakes. And so it is good to provide these tools to these individuals that they could then be able to support not only themselves, because many of them live by themselves, but also their family members. And since the lockdown of COVID, we have provided 1,180 individuals with not only food boxes, but also we provide the El Jíbaro Urbano, which is the urban, you could call it the urban jíbaro, which is our person who harvests. And we provide them boxes not with seeds, with dirt, and with planters so they could use dirt therapy as well as plant their home gardens in their spaces. It could be their condominiums, their apartments, or it could be in a room that they have, but that way they can grow their vegetables and little things to make them feel better about the situation of being in the lockdown. Plus, we have provided all of our services since March of last year in a phone or internet basis, and we have provided laptops and phones to many of these over 235 individuals so they could receive mental health services during COVID. And now we're going hybrid, which means that if they are vaccinated and they feel comfortable, they can come into our facility or they can continue participating from their home base. During COVID, and I should say before COVID, I was seeing, as a mental health care provider myself, I was seeing the high incidence of suicide attempts by the older individuals, which is very different in the United States. In the United States, we assume, and statistics show, that suicide attempts and death by suicide are mainly among youth due to bullying. In Puerto Rico, because of bullying as well, it is in the older adult. And more impacted are the older adult LGBT. The data that you have in the United States, just flip it with the age, and that's Puerto Rico for you. So in Puerto Rico, I have been informing the members of the diaspora, as well as our own constituents, about the importance of educating and supporting each other and expressing yourself. So last year, we developed a campaign with the New York City Aging Department, as well as Puerto Rico here, Boricuas, about the importance about expressing themselves. And let me give you some statistics after you see what we prepared for radio and for TV about this campaign that we titled it, Exprésate Boricua. Ángel?
Los recientes desastres naturales y el COVID-19 han devastado a nuestra gente.
Muchos hemos perdido empleos, hogares y seres queridos.
Si eres un adulto mayor LGBT y sufres de depresión,
ansiedad o pensamientos suicidas,
no estás solo.
No estás sola.
Hablar es el primer paso para sentirte mejor.
Exprésate Puerto Rico. Podemos ayudarte.
Llama a Sage Puerto Rico, Centro Comunitario LGBT para el adulto mayor, al 787-940-8851 o visita wavesahead.org.
So that was the PSA that we ran in radios here for over 10 months. Right now, it's still being played in some radio stations. And then in the TV, we have begun that second chapter for this campaign. And soon you will be seeing in the 3 major TV stations here in the island that will present that commercial that you just saw. It is important to educate not only LGBT individuals, but our allies, our family members, about this issue that is impacting so much our older adults. People here in Puerto Rico are feeling lonely, isolated, and with COVID, even more. That was the feelings before the hurricanes, after the hurricanes, before the earthquakes, during the earthquakes, and now during COVID. And so much the impact of that is by the economy that we have been managed by this group of individuals that many of them are not Puerto Rican and have managed our finances as a country, that we are being impacted by the US policies and procedures upon us. So that tells you a little bit about us. Our other program is called Descúbrete. Descúbrete is about empowering that micro business entrepreneur, female head of household or LGBT individual or older adult that would like to develop their own business. And we have provide them patient, well, the patient's hard to provide, but we provide them that support to deal with the government bureaucracy to develop their small business. So we try and assist them in developing more patience for the process, and we assist them in developing their business. Until now, we have provided 82 individuals with their support to develop not only their micro business, but also their nonprofit organization. One of the most known in the island and above the outside of the island is a group called Siete Quillas. They're a turtle saving entity that works with the beaches, with the beach erosion that we have here in the San Juan area, and saves the turtles because they come to harvest their little turtles. And they do it here in Ocean Park, which is an area that is most frequently by tourists. So if you have come to Puerto Rico, most probably you have been to San Juan and to the area of Condado and Isla Verde and Santurce. And so that area, those are the beaches that they put their eggs, and then they come back every year thereafter. And so we do, we work with that group to establish them as a formal entity, and we were able to do that. So that's just one example. I see that Stuart joined in. I just want to say a thank you for his support. Stuart, I know you're just joining in. I don't see you among all the people here, but I just want to give you my gratitude because you were instrumental in how I developed my community-based programming in Boston, and I continue doing it here. So thank you, Stuart, for giving me the tools necessary to establish. So you're one of those instrumental individuals that impacted my life. So thank you. I don't see you still, but oh, there you are.
Here I am.
And now I see you. Hi, Stuart. Great to see you.
Yeah, I had a conflict earlier giving some technical assistance to another island nation, not in the Caribbean, but not Puerto Rico.
Well, hope I can see you soon here in Puerto Rico. So that's our other project, which is called Descúbrete. And then you saw in the video Empoderate. Empoderate is a brand new initiative to continue educating our LGBT members as well as allies about the policies that are impacting locally here in the island. And we just had it, the first Academy of Empoderate last August of 2021. And our hope is to do it once or twice a year to train individuals on the things that are impacting and how they can make a change. One of the things is what Rudy mentioned at the beginning, which is the conversion therapy, that for many, this topic is non-existent anymore, but here in the island, many of the fundamentalist and religious rights groups are continuing using it with our youth, with our elders, to convert them into being straightforward. There's more to it, but I'm just going to leave it at that. So we testified in the Capitol here in Puerto Rico, as well as have been meeting with many members of the community at large in order to teach them about why it's important to abolish this type of therapy that is still being used and it is still being receiving funding to do it. So having said that, our program is very much works with all the intersectionalities of the individuals that are found in the LGBT community. And one of the things that we have seen, not only in the United States, but here in Puerto Rico, is intersectionality of those living with HIV and AIDS that are aging. SAGE in New York, SAGE National, has a HIV/AIDS policy working group that works with some individuals in DC to try and bring about change in health insurance entities and Ryan White and so forth to be able to develop a segment focused on the older adult that is aging with HIV and AIDS. And one of the things that they have realized is the need for data. And here in Puerto Rico, it is a problem. The Puerto Rico Department of Health has received much needed dollars to do these type of assessments, but until today, they just haven't done so. They only do quality assurance of services, but not about the needs assessment. And as you all know, these individuals are aging and their needs change. One person today, tomorrow, your needs change. And it's important to do needs assessment, not only as a baseline, but also during the time that you're living with HIV and AIDS. And so many of these are veterans of the field in the sense that they have lived with HIV and AIDS for many years, but no needs assessment had been done. Why is that? Well, we have our hypotheses. Rudy, Alexandra, and I have our hypotheses, but this is my own hypotheses. Excuse me a second, because this is not closed. Okay, I just closed it. So my personal hypothesis is all political. So that's the bottom line. You know, in Puerto Rico, we are a colony of the US. So we have to accept whatever dollars are given to us. And we're supposed to say thank you, namaste, and move forward. Well, it's not enough. Second of all, the political parties use the dollars that are received for other purposes, not for the purpose of marginalized groups within Puerto Rico. Marginalized groups such as the LGBT community. So as I mentioned in my meetings, we receive the M&Ms, but we don't receive the bag of M&Ms. So we only receive very few pieces of M&Ms, and we're supposed to eat them, and we should be happy. But we're not, because those few M&Ms are not enough. And so there is such a need here in Puerto Rico, and the Department of Health and the governments that have swapped every 4 years. And as you all heard in the news, in 2019, we had 3 governors in less than 2 weeks. So there is a lot of red tape, as well as many governors have different thinkings about how to handle the community here in Puerto Rico. And so we always are advocating and providing services for the LGBT older adult, and that's what I continue advocating. And so it is a problem here in Puerto Rico, not only funding, but also the supports necessary to be able to provide these services across the island. It's a small island, you might say, 100 by 35, but the only thing is that there's no direct roads. So there's a lot of curves. And so we have developed community centers that we are able to provide from those community centers to the vicinity of the municipalities, those services. We provided first in San Juan, then in Cabo Rojo, which is in the southwest part of the island, now in Maunabo, which is in the southeast part of the island. And soon next year, we'll be able to provide you more details, but in Isabela, which is in the northwest part of the island. Each community center provides the same type of services plus others. Like in Cabo Rojo, we will be having the first shelter for older adults and for youth and for LGBT people, providing transitional housing for those individuals. That center, I can say, and this is brand new to all of you, is that yesterday we got the title of ownership to the building finally. So there's a lot of bureaucracy. So I have to also, I lost a lot of hair. Stuart most probably saw me with more hair, and these years totally gone, Stuart. I joined your club. So exactly. So we in that shelter will be opening hopefully early next year. There's some remodeling that we will start in November, now that we have the title, and to be able to open and provide those services. In a second, the one in Isabela will have housing units. We are developing with National Equity Fund 30 units of independent living in Isabela, plus our community fourth center. So in Maunabo, we're developing a pharmacy and our medical clinic inside our center, which will be different. And that center is focused on the individuals living with HIV and AIDS. And thank goodness to this assessment that I'll present just a few slides, and you'll be getting a copy of the whole presentation of the needs assessment, is that I was able to use that information to be able to advocate for the establishing of this unit in Maunabo. Let me pull it up. Let me see. Can I share it? Share screen. Here we go. Oop. Let me center it. Slideshow from. Before I begin, do you have any questions or comments up to now? Okay, so this needs assessment, we did it between April and June of 2021. Ages 50 and above, living with HIV and AIDS. We collected a little bit over 500 surveys, but we were able to use 264 that meet the criteria for the study. The criteria was that you have to live with HIV and AIDS, are living in Puerto Rico, and our LGBT community. There were some Puerto Ricans that were living outside of Puerto Rico who answered this survey, but we also wanted to just be assessing the needs here in the island. And for you who may not know, there is a lot of movement between Chicago, New York, and Orlando, predominantly, those three, but there's many other cities in the Northeast that have a lot of Puerto Ricans that come and go as they please. FYI, we are a colony of the United States. We are US citizen, although Trump said not, but we are US citizens when we're born. And so we do have US passport and we have the US citizenship. So although he declined to accept it, that is our, yes, it's true. So FYI, if I'm breaking any news to you, just let me know and we can talk about it offline, but we are US citizens. We also collected 13 interviews. And I mentioned that about the citizenship because every time I'm talking to people, they said, oh, but Trump took it away. Some people say that. I'm like, no, he didn't. He wanted to, but he didn't. Anyway, the areas that we wanted to cover, not only demographics, but assess the mental health services, medical health services, complementary and alternative health services, and the needs that older adults may face, the technology use. And of course, because we did this during COVID, although the planning for this did not occur during COVID time, it was in 2019 when we were starting to plan this, but we didn't receive the funding until early 2020. And then in March, we were hit with COVID. So the planning had to add a component of COVID. Although at the beginning, I do disclose that it's not COVID specific. There is a larger population that we expect in Puerto Rico of that are LGBT, and using the statistics, we found that we had a targeted margin of error of 5%, which is significant. And really, we were able to assess we used the statistic of William Institute. And I'm going to go a little bit fast. So
Wilfred, Wilfred, if you can go back.
This one?
Yeah, that slide is very important. How can you determine what is one of the biggest problems in conducting research with the LGBT population? So that was the problem that the research team, the evaluation team was confronted. And this is how we approach it. And I would like to later on to get the input from the LGBT business groups, stewards, and the subject matter experts. This is what we did. First, the Puerto Rico needs assessment is needs assessment, the one developed for HRSA and Ryan White is telling us, for HRSA and the CDC, telling us that there are 6,200 people over 50 living with HIV. Fine, let's begin there. That includes everybody, the LGBT, straight, includes everybody. So how come of those, how many would be members of the LGBT? So what is the think tank on LGBT estimate is at the Williams Institute. They do it almost every 2 or 3 years. They come with an assessment. And one of the last one was at 4.5%. Fine, 4.5%. So I said, okay, what I'm going to do, I'm going to multiply that by 4 to estimate. So if when I multiply that by the 20%, I ended up with that total. The slide at the end is wrong, but the 20% is like 1,200, not 5,939.
Here you go.
So
these are the
so later on, I would like to discuss with you, like to talk to you guys about how we came about doing this. But go ahead, Wilfred. It's just that's a very interesting point for us here. How do you estimate sample size, power analysis for survey reaches with LGBT group? Yeah, we can go on.
No, does anyone have any comment or about this?
Okay. Oh, here it's my.
Okay, so nope. Why is it not letting me? Oh, okay. So because of COVID, it was also a second issue was how to approach these individuals. It was during the beginning part of the pandemic here in Puerto Rico, and how we were going to approach it, because many of these individuals didn't have technology, we thought. Well, we developed this card that was distributed among many of the clinics that they were still going for services, and we promoted it very heavily in the platforms, in associated groups here in Puerto Rico, as well as our members, and then we started to distribute it that way, as well as other clinics, and that's how we distributed. This was the flyer, and this was also the announcement that we posted in the internet. Here's the age range from 50 to 78. Medium age was 57. We had 244 males and 20 females. Okay, now this is a little bit about the marital status, and when you get this presentation, you can go through the details. In the interest of time, I'm going to move to, this is a little bit about the municipalities, mainly concentrated in the San Juan municipality. San Juan is comprised of 5 municipalities around San Juan. So these are some of them and some of the respondents, but we did have distributed around the island. So we did capture many of the individuals living throughout the island. So some of the social determinants of health that we addressed and we questioned was transportation, housing, education, employment, health insurance, and income. I'm not going to go through all the details, but few of the details is that it did confirm our idea that there lacks transportation around when you leave the metro area. And even in the metro area, there's some areas that are very much far from where the bus line or the train that we have really a very, many of you are from Boston and you think, oh my God, they have a train. No, it's just like 8 stops or 9 stops. It's a very, I call it the monorail, of the metro area, because literally it only goes through the business area and through educational area, not beyond that. So it's very limited capacity. Oh, and through the hospital, the public hospital here in the metro area, Centro Médico. But transportation is an issue, and the transportation, when you move outside of that train line and some of the buses, and during COVID, they were non-existent until earlier this year of 2021. And so I think they started in March of this year when they started again, and they're very limited. And they only allow 10 to 15 people at a time in a bus, something like that. I don't know the number, but it was very limited. And then we have these little vans that are run by private individuals, and those have changed dramatically the routes that they take since the hurricanes, because their stations have been destroyed and not rebuilt in many instances. And in other instances, because of lack of money, they moved outside of Puerto Rico, or they moved to another area to be able to earn a little bit more money. So all those lines that are public transportation, but really semi-public, have really impacted the accessibility to many of these individuals who were used to doing using those. In regards to in regards to education, it was interesting. Many of them did have at least 6% included completed a doctorate, 22 completed a master's, and bachelor's 27%. This is a very highly educated individual, but when we saw the social determinants, all of them were impacted. So it didn't matter their educational levels. 1 in 4 did not own their own car. And interesting, later on in the discussions, you know, I would have loved to know if their transportation that they own, did it work? Because many times their cars, although they own them, because of the impact of the hurricanes, they may not work, or they may not have the money to fill up the tank with gasoline in order to move from one place to another. So that's something that we did not ask, but that I would be interested to learning more about how the transportation impacts their pocket as well. Health insurance, just less than 3% do not have health insurance, and income, about half annual income is less than $15,000. These are some of the major difficulties that they reported. And one of the things that I wanted to focus is about food and housing. This was very impacting to all of us, that 21% did not know how to have food for tonight, or do not have enough food for tonight. Once again, these are people who are educated, who have experience, who have access to medical services, but not to food. This was very impactful for me as an individual living here in the island. And it's something that we strive to work food sustainability here in the island, and that we need to focus more of our attention to. And then when it comes, medical service needs, you will be able to get this, so you will be able to see that there is a need for these services. Specifically, a lot of sexual reassignment care is an issue for many of the transgender folks who answered it. And then you can see nutrition, oncology, etc. Many of these services are not available. Many of the individuals that provided these services left the island in search for a better income outside of Puerto Rico. So we're losing a lot of the medical field specialists here. And this is some of the complementary and alternative medical services that they would like to access, but didn't have access to. Mental health services is an issue that is not enough what is being offered to them, or they don't have accessibility, mainly to couples or family therapy. And you can see it all throughout the different types of counseling and individual counseling and therapy that they needed, and the services, and didn't have access to it. And then about housing, and I want to spend a few minutes about housing. Housing is an issue. Many of these individuals live with a friend or relative, 1 in 5, on a temporary shelter, or had other arrangements. This is a very high percentage. And these are people living with HIV and AIDS that don't have a permanent house or a permanent apartment to call a house. This is interesting because we know that the impact of the hurricane has impacted all of the island, everybody. And then when you come to the earthquakes, it's only the southwest part of the islands that were mostly impacted by these earthquakes, and that's still being impacted. But because when we're assessing the whole island and people living with HIV and AIDS, this is very concerning. 1 in 5. You all have heard, David Benoit has reported on this issue here in the island, but he continues reporting, and many other reporters say that we're receiving billions of dollars for housing, over $8.5 billion. Puerto Rico has only received 2.8% as of today of those monies, meaning only millions of dollars, not only that. So it doesn't reach more than $10 million that we have received for an island impacted not only by the earthquakes, but by the economy and by the hurricanes. So you might hear about the billions of dollars being approved by the past president and by the current president, but none of those fundings have been received. And when they come to the island, they're being developed into luxury condos. Right now, there's over 8 different luxury condos in development with public funding that our population will not be able to access because they don't meet the criteria to meet them. This is concerning for the future because most of our population, as I started this presentation, is aging. And there's not that many organizations providing the supports needed for this segment of our population. So this is about 8% do not have a place to call home tonight or to sleep tonight. This is very much so an issue that we need to address, not only in the States, but here in Puerto Rico. And in Puerto Rico, there's a lot of houses that are being abandoned because they're leaving Puerto Rico to live in the States. And right now we are developing a policy with the mayors of the towns that we're working in, as well as with the state legislature here in Puerto Rico, to be able to make it more easy for organizations like ours to be able to take those homes, refurnish them, and be able to put them out in the market. So it is a lot of work right now, but hopefully in the near future, it will come to fruition and we can use it for house more of these individuals that need a home. We conducted interviews, and you can read when you get this presentation, many of the respondents' interviews. One of the ones that most impacted us is one that talked, and I'll get to it in 1 second, that talk about Facebook being their therapy, their therapist. Let me not find it right now.
The therapist of the poor.
Yeah. Oh, here it is. Because the psychologists are expensive, I say the poor people psychologist is Facebook. They get in there, they vent, they cry, people criticize, they speak. I enter, I look, I read, and I leave, and I feel, and that person felt better about themselves and about what they're going on. This is concerning because Facebook, as you all know, and many other platforms don't have the most accurate information or the best information about how to seek mental health services. We are spending more as an organization to really be able to support and to put out there messages of hope and also of how to seek services. But it's very important that we all educate our colleagues, our friends, even if they don't live in the island, because someone is in need, and someone needs that aid here and abroad. Financial distress, as you might expect, it is an issue for many of them. And then the COVID effects, of course, it has impacted us all. I'm sorry to have rushed through these slides, but I want to allow at least 10 minutes for questions and answers.
Wilfred, can you clarify, can you say again, because you and I had a discussion. First, we didn't find any major findings related to activities of daily living and the elderly. And I said, do you know why, Wilfred? Because they were as young as 50, 50 plus. But as you know, in geriatric gerontological research, the elderly definition is usually 65, often 60, few studies 50. But there is a reason why you selected 50 as the cutoff age. And can you share with that, Wilfred?
Sure. In LGBT care and in advocacy, we're seeing that LGBT individuals need that prevention approach to health. And so we are getting older, not by age, but by how we have been treated or mistreated throughout the time of accessibility to health issues, healthcare. You know, I'm not there yet, although I'm part of the membership of this group, but I'm not there yet. And although my health is not the best, but I have been mistreated. And so personally, on a personal note, my doctors here in Puerto Rico now know me, but when they first met me, they said, oh my God, this crazy person asking for LGBT care. What is there to be a difference? And there is a big difference. So I have been needing to teach my doctors about the need for LGBT people to access healthcare in a different way, or the approach in a different way. It's such a need. And so that's why we start LGBT older services at 50 instead of 65, in order to allow those few years to be able to prevent anything that may be approachable. And I know Stuart has done a lot of research about cancer, about so many public health determinants in LGBT. And so that is an issue, and we see it all the time. Even substance abuse, we see it as an issue with us at a lower age than the heterosexual counterparts. I want to address some of these questions and comments that were in the chat. Okay. Working Puerto Rico has been an honor. Puerto Ricans are determined, committed, and resilient. That's true. Among many others attributes I have seen. And third, my question is, what are some of the efforts for plans you have conducted working with Puerto Rican families living in the mainland to support their relative in the island? You know, this is an issue that we need to continue focusing on, how to educate our counterparts who live in continental US, around Europe, and around many other parts of the world, and how they can be committed to the work here in the island. It is a piece about education. We continue, because of my connection with SAGE, with Ariana Center in Florida, with PFLAG, we are needing to continue educating everybody in continental US about the issues that are impacting us, not only what appears in the media. David, we applaud him for always covering Puerto Rico, but that's not even enough. And he doesn't take care of all the different topics about our intersectionalities. He did cover us when there was killings of our transgender brothers and sisters, that we are almost at 21 at the moment. He came to the center here in San Juan, where I'm connecting with all of you, and did a beautiful story about the need for approaching of education, about homophobia, transphobia, but that's not enough. People already forgot about it. And we continue being in the list of homicides against our brothers and sisters at a very much alarming rate than in any other state of the United States, so, or territory for that matter. So that is very concerning. So we need to continue educating and being able to, as an ally, just talk to them and continue demystifying those wrong informations that the past president have inculcated in so many people in the United States. He did have good handle on Twitter and all that crap. So, and he did impact in a negative way Puerto Rico. Is there any way that SAGE organization can create a voice for use of housing funds to address the dramatic needs of LGBTQ and other groups in need? SAGE, it is a priority for SAGE. SAGE just opened up 2 huge buildings in New York. Well, the second one is being opened now because COVID had a delayed, but they're open one in Bronx and also in Harlem. So they are doing a priority. They are giving us some of the tools. Funds is always a problem. And that's why we also published that study about housing specifically for the LGBT population. You can see it in our website at wavesahead.org and look at the 2020 report. Tells you that most of those fundings do not reach the island. And so we do have a lot of those issues here in the island. Because we are a colony, a territory, some of those fundings will never come to us that the United States does have the access to. Isolation is often one of the biggest issues for older adults. That's correct. How does isolation affect older LGBT folks in Puerto Rico? Is it similar or different than the United States? It is a little bit different in the sense that here in Puerto Rico, more LGBT older adults are dying because of suicide or are doing a lot of suicidality plans and do it. Many of our emergency rooms are being used by older adults. In a study that we participated and assisted on, over 68% of all emergency room visits are older adults, 55 and above, and more than half of them are because of mental health issues and not physical issues. So that is a major issue here for the hospitals. And the government here does not understand that if we treat mental health in a preventive manner, we can impact the long-term economy of the country. So that is, I think, and also isolation. Many of these individuals don't have family nor children to take care of them. So they live isolated in the countryside. So when their partner, if they had a partner, dies, they're alone. And in the hurricane, we saw many of them. That hurricane discovered or rediscovered the issues that many people did not want to address or that did not want to face, including the government. Yep.
Thank you a lot for your presentation. Some of my colleagues will be in touch with you. They want to talk to you about perhaps future things that we can do together. So we are going to be in touch with you. And people, tomorrow we have the last Yes I Puede presentation. Dr. Patria Rojas, a former JS, is coming here to talk to us. Thank you, everybody. Thank you, Wilfred, for your attendance and for all you do in Puerto Rico. Okay.
Thank you for the invitation. I'm sorry. Some of you who have your questions that I didn't cover, just email me. Rudy has my contact information. I can definitely have a conversation with you. So thank you very much for the invitation. Bye. See you guys.